The shingles are known to cause a painful rash with blisters.
While it often wraps around someone's side or back, a local man puzzled doctors when he got it on the inside of his body. When it paralyzed his face, he desperately sought help from his eye doctor.
Robert, why don't you close your eyes? Let me see.
39-year-old Robert Carlisle was a busy dad of 5, going to law school when he got terribly sick. He luckily found a unique treatment at Eye Health Consultants to help him recover from the shingles. He was diagnosed in August and is still fighting the aggravating symptoms.
And how about the face? Can you smile? Okay, it's getting there. So you see, we are getting some tone back here because he had no tone whatsoever.
First of all, Robert is younger than most people who get the painful rash, and then his case was misdiagnosed for weeks as a sore throat and earache. Even Robert's dad can understand the misdiagnosis.
I've never heard of anybody having shingles inside. I've always, known people that have had shingles somewhere on the outside their body.
When Robert's shingles finally came out of his ear, spread up his face and forehead, doctors figured it out. But shingles heals best with immediate antiviral medications, which he didn't receive.
It damaged the cranial nerve in his face, which caused it to droop down like he'd had a stroke.
That's when Robert came to Dr. Julio Arroyo for help, who could tell that cranial nerves were in danger.
He was in pain, in very much pain, so we figured the trigeminal nerve was involved, and he also was paralyzed from one side, which tell us that the facial nerve was involved. So when he came in, he could barely move his eye at all. I mean, the left eye was fine, the right eye was fine, the left eye couldn't even move at all whatsoever. So it was constantly open. We had to tap it and patch it to protect the cornea from getting sick.
Dr. Arroyo knew he had to get creative to help Robert and is using 2 devices with infrared light. They're strategically placed on his face for his particular condition, including through his nose.
That's one of the areas in our body that has the most exposed vascularity. So we can reach the blood circulation very easily, non-invasively, just by going through the nose. So that other one enhances circulation. So we're helping him getting the oxygen into the hemoglobin of the red blood cells more effectively, more efficiently. So this simply provides the elements that help his own body heal faster.
And Dr. Arroyo says patients who suffer from Bell Palsy have similar symptoms with facial paralysis. So he says this treatment could help them as well. Robert's dad has been by his side through the entire ordeal and has high hopes for his son.
What I'm seeing happening is that he will gain full control over his face. He'll be able to smile again. He'll be able to close his lips. We want him to be able to swallow because right now he can't swallow, so we have to feed him with a stomach peg for feeding right now.
Robert joins us now in our studio to let us know how those big goals are coming along. I'm glad to see you smiling. It's there. So all of that we just showed you was in November. We've been waiting for you to get stronger so you could travel to our studio.
Yeah.
Tell us where you are on your dad's list of goals for you.
Well, I'm making steps every single day. I'm stronger every single day. As you can see, I can smile, and you can see my teeth. I'm talking, which in that interview, I couldn't get above a whisper, and now I'm talking. It's really been amazing.
Wow, you've come so far. And this diagnosis really could have been devastating. And at the time, I'm sure it was.
It was.
You're a father of 5.
Yes.
You were in law school. Tell us how this really affected your life.
For a moment, it completely derailed it. But the University of Houston was very supportive. They put me on a leave of absence. I'll be going back in August to the University of Law Center.
Oh, that's huge. As we look here at your kiddos, how has it affected you as being a dad and them? I'm sure it's been hard for them to see. And this is what you look like right before you got the shingles, so we can tell that you have lost weight.
Yeah, I've lost 40 pounds. It's been stressful, but the kids have, circled the wagons. They've been very supportive. It's been we've grown together as a family through this. And, we are survivors. you know, and I'm a survivor, and we've just pushed through it.
Yeah. What do you think people can take away from your misdiagnosis and your journey?
You know, just be very aware if you start getting an earache. It may not be an earache. It started out as an earache, the terrible earache. And, you know, I kept getting misdiagnosed, and then I couldn't swallow, and they couldn't figure it out. Finally, it came out of the ear and crawled up the side of the head, and they're like, oh, that's shingles. But by then it was too late, and the damage had been done.
And this happens to 2% of shingles patients.
Yeah, 2%.
So a low percent, but still it happens to other people.
It's pretty rare, and it's hard to diagnose. And the faster you get it diagnosed, the less damage you'll have nerve damage-wise.
Okay, so let's talk about the rest of your goals. So it looks like you're doing everything so far, except you're not able to eat yet. You still got that to go?
I still have to eat through a tube. I can't swallow effectively. I'm going to speech therapy, which helps with the swallow and the talking. And I'm also going 3 times a week to Dr. Arroyo with his bioenergetic medicine, which has just vastly helped me.
When you first heard about this kind of treatment that we're looking at now, what was your reaction to what was going to happen to you and how you were going to supposedly heal from this?
The infectious disease doctor told me that it would take 1 to 3 years to recover from this, and I was absolutely devastated. When Dr. Arroyo mentioned it, because my eye was in danger of being lost because I couldn't close my eyelid and it was drying out. He mentioned this treatment. I said, let's go for it. I mean, and the first treatment, I could feel improvement. My muscles would start to move, and I had no movement before. My first treatment, I walked out of that office crying because I had hope.
It's incredible. And patients who have Bell palsy, he believes can be helped from this because it is a lot of the same symptoms where you don't have to go for. We had a colleague who was at home with it for 2 months, but with this, you were doing better within a few days or weeks.
Yes, I mean it's quite amazing. It's nothing short of a miracle. It's just it's so great to start feeling myself again. And it's very similar to a stroke, and it could help stroke victims.
That would be very promising. So it sounds like you have a really positive outlook now on,
Yes.
on where you're headed, and,
Yes.
and we wish you all the best.
When do you hope to go back to law school?
August.
In August.
Yes, in August.
You can do it.
Thank you.
Follow
Thank
up
you.
with us and
Absolutely.
let us know. It would be great to see you back there, and just the best to you and your family. And thank you
Thank
for
you.
sharing your journey with us.
Thank you so much.
What a story.